Good morning, everybody. I'm Christine Aronson. I'm the co-director of the National Center for Interprofessional Practice and Education, and I'm really delighted to be able to welcome you all to today's webinar. This represents an enormous amount of work that started years ago with conversation cafes at the Nexus Summit, but has really been picked up by this incredible hardworking group from AIHC and who've really gone above and beyond. And I'm really excited for them to share what they've learned from the most recent survey and kind of where this work is leading to support our profession and our work in the field. So without further ado, they'll be introducing themselves, but I'm delighted to turn the discussion over to Patricia Otake, who's going to start the conversation today.
Thank you so much, Chris. I really appreciate the opportunity to be here with you today, and welcome to everyone who's joining our presentation. For Dr. Aronson, it's the morning. For those of us on the East Coast, it's the afternoon. So today we're going to share with you the results of a national survey about organization models of interprofessional practice and education in the United States. This survey was endorsed by the American Interprofessional Health Collaborative, AIHC, and also the National Center for Interprofessional Practice and Education. Next slide, please. I'm delighted today to be joined by Dr. Andrea Feifel, who is Associate Vice Chancellor at The Ohio State University, and also Dr. Sarah Schrader, who's professor at the School of Pharmacy and Pharmacy Practice at the University of Kansas Medical Center. And I'm Patricia Otake, and I serve as the Assistant Vice President for Interprofessional Education, and I'm an Associate Professor in the Physical Therapy program at the University at Buffalo. Next slide, please. The three of us are representing a large group of 17 dedicated and talented AIHC task force members whose expertise and hard work have resulted in providing us with this really cool snapshot of the organizational models of interprofessional practice and education here in the US. It's a tremendous group of people that we work with. Next slide, please. So the objectives for our session today are to describe the results of the national survey and then go that next step further and discuss the implication and next steps for the IPE field. And finally, to identify the major takeaway points and recommendations based on the survey results. Next slide, please. The task force was charged with the design, deployment, and dissemination of results of a survey that explores current status of how interprofessional practice and education is organized in the United States. The topics in the survey included basic demographics about the respondents, and these respondents were asked about the IPE structure of their programs, the financing of their programs, the leadership and organizational structure from the leadership reporting line, the personnel that were involved with the IPE program, and then there were questions also about the institutional culture that existed within their setting, as well as the presence of systematic IPE plans. The findings from this survey can be used for many things, but potentially we've identified a few. Maybe potentially they can be used for identifying national trends and progress in IPE, potentially for benchmarking data for program enhancement or sustainability, to inform new programs. And I'm sure there's many more ways that these data can be used. At the time of this survey, so this is a map of the country that shows the participants, the people that have self-identified as having an IPE center. And so at the time of the survey, there were 131 self-identified leaders of IPE centers, programs, and initiatives in the United States. And a survey was sent to each of these leaders, and we received responses from 80 institutions. Then this yielded a survey response rate of 61%. And I encourage you now to look at this map and also go to the website, which is listed here, and find this map and check if your institution is listed there. Because if it's not, we encourage you to become part of this group and identify your center on our map at the National Center. So this survey was built on existing scholarship, and the scholarship specifically related to the role of academic health centers in interprofessional practice and education, economic models of interprofessional programs, the structural, human resource, political, and symbolic dimensions of IPE programs. And we also looked at scholarship that identified the factors that are critical for success of IPE programs. And as Dr. Aronson said, we incorporated conversations and outcomes from the conversation cafes at the Nexus Summit for the years of 2016 to 2018. And then the methodology, here's an overview. The IRB at the University of Minnesota approved this survey as exempt research. The task force was formed from interested AIHC leadership and members. And then in July 2019, a pilot survey was tested according to the methodology of Artino and colleagues. And this voluntary survey was administered using Qualtrics survey software. And the report of the results and input from the initial pilot was presented at the 2019 Collaboration Across Borders meeting in Indianapolis. And the final survey was then deployed in November and December of 2019. And the survey data were analyzed using quantitative analyses, reporting frequencies and percentages, and the open-ended comments were analyzed using qualitative analyses. And now I'd like to turn it over to Dr. Schrader, who will be sharing the results of the survey.
Hello, everyone. So we are going to start with the survey results. And the first thing I want to mention is that I'm going to go through all of the results fairly quickly. I think Sean Diego put a link to all of the specific results in the final report that's now on the National Center's website in the chat box. So if you want more information, you can go directly to the report yourself. I'm not going to editorialize very much during my portion of the presentation. We've saved the end portion of our presentation to have more of a discussion about the findings, and we certainly want to engage you in that conversation as well. So I just wanted to sort of set up some ground rules. So basically, I'm just going to share the data. So we have the demographics of our 80 respondents listed here, and you can see that according to this chart, we did have representation from certainly all of the regions of the United States, most of the states themselves, and many programs within the states. We did ask people to identify their Carnegie classification of their university or college, and you can see that our sample represented mostly the doctoral level universities and colleges. We did ask about the maturity of the IPE programs, and you can see here that about 20% of respondents had their IPE program for over 10 years, and about 36% had it from anywhere from 6 to 10 years. So I think it's important to keep that in mind in terms of who is represented in our survey, because I think that newer programs and programs that are just forming, we need to be mindful that we may not have captured all of that data. And then you can see that we have most programs had very large numbers of learners, which should be of no surprise for IPE leaders that are on this call today. You know, we have a lot of challenges with the logistics of managing of this with IPE programs. And we have most people having greater than 900 or at least 300 or more learners represented on multiple campuses, and you can see that people are able to offer most of those IPE initiatives across the campuses themselves. So in looking at the very first portion of the survey, we dove into what is the IPE structure that best defined your program. And you can see here that, sorry, 1 second here. I need to move, you know, on Zoom, how the little bars float around. It was covering my numbers and percentages. Okay, so you can see that according to this particular chart, that the centralized administrative structure was the most widely available structure, with over half of respondents stating that that is how they were organized. You can see that was followed by a formally appointed standing committee where about 20% of people picked that choice. And then you can see toward the bottom that there were a few organizations that answered that have no formal structure in place, but are still able to offer some IPE. So you can see here that the trend is definitely a more centralized approach. The next question was what we call a branch logic question on the survey. So of those that did have some formal structure, that answered yes to the ad hoc structure or centralized structure, or they had a formally appointed committee, it did ask how it was housed. And you can see that the majority of people answered that their program stood alone, kind of like the library, and worked across professions and programs and reported to a central senior administrator. So 45% of respondents picked that choice. But you can see that there was a significant number of people that also have their program housed within a single college or housed in central administration and report to like a council of the deans. So in terms of the administrator that the IPE structure directly reports to, this one was answered. First of all, this was a difficult one for even the group to come up with because every university has sort of a different name or designation for a lot of these administrators. So we did our best and we asked respondents to answer to the best of their ability who it was that they reported to. And so you can see that there's a lot of variability here. And many people chose other because it wasn't quite so clear cut. But of the choices that were on the survey, you can see that the administrator that people chose the most were a dean or deans, and that was about 20 people, and then also provost at about 16 people. So then moving on to multi-institutional collaboration, we did ask if people were collaborating with other institutions and had some sort of consortium, whether it was formal or informal. And no surprise, in this space of IPE, we are collaborative. So about 73% of people did report that they have some sort of multi-institution collaboration. And so we asked in general and people could select more than one answer, why are they using these collaborations? And people chose, the majority are doing it for educational purposes because we had a lot of institutions that were either single health profession institutions or only had a very small number of health professions programs, and to make their program more robust and have more IPE learners from different professions, they had to partner with other institutions. You can see that lots of people are doing great work in terms of collaborating regarding networking and research as well. So in terms of financing, we asked, first of all, to try to find out if people had a dedicated budget. And you can see here that the majority of people had a dedicated budget, which is good. Internally, a dedicated budget that was funded completely or almost completely by the institution itself was the most popular choice here. About 46% of respondents have that. You can see that people did select also that they had kind of a mixed budget where they had both internal and external sources of a dedicated budget, with about 25% of people answering that. The good news, I'm editorializing a little bit here, but I think we could all probably agree that having an IPE program solely funded based on external funds is probably not sustainable. And you can see that no one picked that. And then you can see, though, that there were still many programs that had no dedicated budget. So it seems that there's still maybe some work to do regarding financing of IPE. In terms of the other thing that I wanted to share here, we did ask some questions regarding budgetary amounts, but because we really did not collect the context of those budgetary amounts, we really have not reported those. We do have this task force looking at some further analysis of that information that might be shared later. We are hoping to put together a manuscript with more information. But what I can tell you based on the data that we did collect in regards to budget amounts, of those that did answer that they had a dedicated budget, over half of the respondents had a what I would call a quote-unquote substantial budget that was over $100,000 or more. And the range was anywhere from $25,000 for an annual budget all the way up to greater than $500,000. So thinking about leadership, we asked if there was a formally designated leader for IPE at their institution, and you can see that 80% of people reported a dedicated leader. And of those that did report a formal dedicated leader, we asked how they were selected, and over half, the leader was appointed by administration, and about 35% of cases there was a formal search process put out for that particular leader. And then we asked about the current title of the IPE leader at your institution. And you can see that in the pie chart here in the red, 54% of the dedicated leaders had a director title. And then that was followed by 20% of leaders having a senior administration title. And we define that, any type of assistant or associate dean or provost or vice provost, those types of titles are what was included there. And then you can see that was followed by chairs of committees or task force, and then some coordinators and managers. So we did ask about the formal leader and the percent of a full-time equivalent position, how much of that particular time was dedicated solely and exclusively to IPE responsibilities. So you can see here that the majority of people that had a dedicated leader, about 26 to 50% of that leader's time is dedicated to IPE. That is followed by 76 to 100% of that person's time is dedicated to IPE for over a quarter of the people that responded. So then we asked about personnel, in particular faculty and staff. So this was having people answer about the total FTEs of faculty and staff that were dedicated specifically to IPE, and this excluded the leader. So you can see, again, a lot of variability here. There were a lot of choices given, But when you really kind of start to look at this in terms of the groupings, you can see that if you actually add together essentially the 0.76 to 1.0 FTE all the way up to more than 3 FTEs, that portion was the most widely picked. So essentially about anywhere from 1 to less than 3 FTEs are dedicated to IPE, excluding the IPE leader. You can see that many programs are doing this with not a lot of support. So, 28% of respondents did answer that they had less than 0.25 FTEs dedicated to IPE outside of the leader. So hopefully we can see that number go up in years to come. And then you can see, though, that some programs had a substantial, more than 3 FTEs dedicated to help toward IPE. So a lot of variability here, but you can see that there certainly is a trend with having some dedicated faculty and staff for IPE. So then we started to ask about the primary faculty effort model in IPE at the institution. And again, this is where we started to see more variability. So in looking at this, you can see that the most popular response, so most people selected that each college or program determined how to provide faculty effort for IPE, and that there was a variety of approaches used. So you can see about 38% of respondents selected that. And we got quite a few comments in our open-ended comment sections about this, where, for example, what people were saying was that, well, we have certain colleges that require faculty to put effort toward this. And then we have other colleges in our same institution that do not require that, and it's basically voluntary. So we were seeing a lot of variability within each institution. So when you kind of take that one off the table and look at what else is remaining, you can see that we have our next most popular choice is that people selected that faculty members were encouraged to participate, but it was basically an additional responsibility. And you can see that about 29% of respondents selected that, which again, I think for those that are familiar with IPE in this space, we know that there is a lot of voluntary IPE effort going on because we've had a lot of wonderful champions for many years. But I think there is some concern about the sustainability of that moving forward. So then we also asked, what is the primary resource model for faculty effort? And you can see here that, so again, we're looking at, the primary faculty effort, and then we were looking at resources in this particular slide. And again, you can see that the most popular choice was that there were a variety of approaches used, followed by people volunteering beyond formal responsibilities. There were not a lot of people that answered that there was funding specifically for faculty efforts in consensus at that institution. We know that there were people that answered that certain colleges and within that institution dedicated funding for this, and other colleges within the same institution did not. And then you can see that in terms of centralized resources for faculty effort, there were only a few people that selected that particular answer. So then we asked a little bit more about not only effort and resources for faculty, but professional development for faculty. And, again, I'm editorializing a little bit, and I said I wasn't going to do that. But this was, and Andrea will share more, a bright spot that we felt like that definitely institutions were starting to see more investment in both internal and external faculty development, and even had some dedicated funding to bring in external speakers or consultants or send people to conferences or workshops regarding faculty development. So you can see a large portion of respondents selected that they did provide faculty development of some kind for their institution. And then thinking about what types of learners are participating in IPE programs. So we asked about the percentage of students that collectively participate in IPE. And you can see that the majority of respondents picked that anywhere from 76 to 100% of their students participated in some level of IPE. And that was nearly 60% of respondents selected that, followed by about 20% more respondents selected that anywhere from half to 3/4 of their students participated in some level of IPE. And, again, we feel like that's a bright spot that we're starting to see that increase, and hopefully we'll continue to see that even more as accreditation standards have really helped, we feel like, to move the needle for this particular outcome. And then we asked and again, I will just point out that this is collectively participate in some level of IPE. The next question was really defined as what level or how many students are required to participate in some level of IPE. So you can see that certainly there's a movement toward requiring IPE more and more for learners. The majority of respondents selected that it was required for some of the learners at their institution, but still elective for others. And you can see that about nearly 40% of people did say that IPE was required for every single learner available. And then we started to ask about physical infrastructure, and particularly we asked about infrastructure on the clinical side of things, and then the more of the didactic side of things. So the first question was about the clinical side, where we asked if there was a dedicated interprofessional clinical learning environment at your institution. And you can see that we had about 32% of people said, yes, we do have a dedicated clinical learning environment, followed by about 22% more that said that it was in progress and being developed. But you can see that we did have a substantial number of people that answered no. About 30% of people answered no, dedicated interprofessional clinical learning environment. And then we did have a fair amount of people that didn't answer this. And, I think I've heard Barbara Brandt talk about this in other forums that, this term interprofessional clinical learning environment and the in-cycle group, that is all fairly new, and there may be some, additional learning that people need to be able to answer this question perhaps better in future iterations of the survey. And then we asked about quote unquote didactic space, and this was really essentially anything that was not clinical, like a clinical patient care area. So defined as classrooms, small group rooms, simulation rooms. So you can see that the majority of people, so about 36% of people answered that IPE learning space was available, but it was not always sufficient, and oftentimes additional alternative locations had to be found, and many people reported that they sometimes would even have to go off campus to find the particular space that was needed. You can see that was followed by about 33% of people said that they had space that existed, but it wasn't conducive, but yet they made it work, essentially. They didn't have to find alternative locations. And then you can see that, about a quarter of people said that IPE learning space was conducive to learning needs. And then finally, our last section we asked about was institutional culture. And so one of our first questions was about inclusion of IPE and referencing IPE in promotion and tenure guidelines. And you can see, according to this chart, that the majority of people selected that there was no reference to IPE in P&T guidelines. And, about 42, so about half of people said that there was no reference. Now you can see that that was followed by referencing IPE in individual colleges guidelines. So it might be in one particular school or college, but it may not be in another particular school or college. And that's what a lot of people were reporting in their comments, that there was not standardization. And you can see that, many people answered other as well, because I think there was some interpretation with this particular question, and lots of people felt like they wanted to comment on it. So then we asked, to what extent do senior leaders understand what IPE is? And you can see that over half of people selected that senior leaders at their institution had a moderate level of understanding of what IPE is, followed by about a third of respondents selected that senior leaders had an extensive understanding about what IPE is. Then we followed that by, to what extent do these senior leaders demonstrate commitment to IPE? And so you can see here that it was essentially a tie. So about a third of people selected that senior leaders had a moderate demonstration of commitment to IPE, and about a third had a limited extent of commitment to IPE. And then finally, about a third said extensive. So again, quite a bit of variability in terms of the commitment level by senior administrators. And then finally, we asked about the systemic IPE plan that came out in the Health Professions Accreditation Collaborative document, the HPAC document. It was put out, a few months prior to us administering this survey. So we asked, where people were in the implementation of systemic IPE plans. And you can see that half of people said that their institution did have a systemic IPE plan, followed by over another third of people that were developing this particular plan. And then we asked, what did that plan include? And again, these topics were taken directly from those HPAC recommendations. And you can see that people were including, outcomes-based goals, having a deliberate design for a longitudinal-based IPE program that included both classrooms, extracurricular and clinical learning experiences with an assessment plan and evaluation measures, and having a common vision and framework for the plan at their institution. So those are all of the survey results in a nutshell. Again, I would encourage you to go to the official report and download it for you to see even more details about the information. And now I'm going to turn it over to Andrea so she can wrap things up for us.
Hi, everyone. It's my job to summarize the quantitative data that we collected in the survey process. So for most items, respondents had the opportunity to provide explanation or add information to their responses. And a small group of us analyzed those responses, and for the most part, they triangulated what was reported, no surprise, through the quantitative data. So the following characteristics were identified by the majority, defined as more than 50% of the respondents who answered the survey. It's important to keep in mind that this is a convenience self-selected sample pool. But more than 50% of the respondents said there was a centralized administrative structure in place to support IPE. In those cases, there was a formal leader of IPE with a director or something similar to that as their title. More than 50% of the respondents indicated there is a dedicated budget to support IPE. And interestingly, more than 50% of the respondents indicated that they were part of a multi-institution collaboration or network or consortium. There was, across the majority of respondents, between 76 and 100% participation of the health professions students in IPE, and there was a systematic IPE plan in place. Internal faculty development programs were offered for more than 50% of the respondents, and a nice surprise for me, and I'm editorializing here, but I was really pleased to see that interprofessional education was referenced in individual college mission, vision, and/or strategic plans in more than 50% of the respondents. Senior leaders were viewed as having a moderate understanding of interprofessional education for more than 50% of the respondents, but it was not referenced in promotion and tenure guidelines. You can go to the next slide, please. Importantly, the adage that I've heard Dr. Brandt say several times, you've seen one IPE program, you've seen one IPE program, that was very much the case as we looked across the data. There was marked heterogeneity across the universities that responded in terms of infrastructure, dedicated resources, physical instructional space that was provided or available for IPE, and the presence and implementation of IPE curricula in terms of how standardized it was or was not. Centralizing resources emerged as a concern for many of the respondents throughout the survey. This showed up in terms of the stability and the amount of budget, how faculty time was allotted, expected, rewarded for participation in IPE, inclusion of IPE in promotion and tenure guidelines, and the level to which senior leadership was engaged at the institutional level as opposed to through individual colleges. It's important to keep in mind, as I mentioned, that this was a sample. The sample was a convenient sample and self-selected, that there was confirmation bias likely across the respondents, which is a tendency to search for, interpret, favorite, and recall information that supports one's prior experiences or expectations of the data. That, as Sarah mentioned several times, context is difficult to pull from a survey, and so we are pressing more deeply into that as we look at the data results, and as we move forward, we'll be thinking very seriously about how we can understand the context in which IPE is happening across the United States. The interpretation of the questions and the responses, therefore, was varied across the group. We did not collect respondent satisfaction with the survey, and this data was collected pre-COVID pandemic. In terms of implications for the field and next steps, we plan to continue this survey on a every 2-year basis to determine emerging best practices and changes in the landscape for organizing IPE. We will promote IPE sustainability by engaging with the Health Professions Accreditors Collaborative, and we will make a reach to IPEC as well in order to share the information and continue the discussion as to its implications going forward. And we'll continue to advocate for centralized resources such as dedicated budgets, faculty time, promotion and tenure incentives for IPE to institution level senior leadership and across the United States. This is your opportunity to engage with us. I want to make a mention of another next step, which is that we are going to, we sent an invitation to one institutional representative we sent invitations to participate in a post-COVID survey just a little while ago. Sean Diego is going to resend that request to you. We are asking that just one person respond on behalf of each institution. And so you'll see that in your inbox if you were part of the pool that had the opportunity to respond to that survey. So what we'd like to hear from you now is any questions, of course, that you have, as well as any comments that you might have by putting them into the chat box. And the panel will do the best that they can. I'll ask you to unmute your mics if you're on the panel, and we'll do the best that we can to answer your questions, as well as take a scan at your major takeaway points. I saw a question emerge earlier, which was, let me see if I can go back and find it, speaking to the deans, if it was a dean that programs, IPE programs reported to, then how was that considered interprofessional? And of course, we don't necessarily know the answer to that unless it just came up in the comments, but I'll ask the panelists, as they're very familiar with the data, if they want to make any comments about that.
I think what you said was exactly right. We don't know, but we were seeing a lot of people were reporting to a single dean, or there were people that were reporting, basically the IPE program was housed within a single college. So now it's likely that there's probably obviously to be interprofessional, there has to be some cross communication. But again, I think that whoever mentioned that comment is right. I mean, I think that thinking about having a more collaborative structure where it's across colleges or more centralized, again, is what we're perhaps advocating for moving forward. I would just like to say that this is in no means a best practice survey. This is truly, let's see what is happening out there, and we can continue to track it to see how things are emerging and shaping in the field over time. And then hopefully with some time, we can start to develop some best practices out there. So again, I just want to put that out there again. This is not a best practice survey. This is just what is currently happening in the IPE landscape.
Thank you. Here's a question. If you missed, let's see, whoops, it's flipped around. Foundation, did you, let's see, so many respondents claim faculty development opportunities in IPE, but so few respondents dedicated any appreciable time to actual faculty work and engagement in IPE. Do the panelists have any comment about that?
Somebody else want to take it? Andrea or Patricia?
Yeah, Andrea, I didn't hear the question that you're referring to. There's so many flying by.
I know, they're flying by. It was interesting that so many respondents claimed faculty development in IPE, but so few dedicated appreciable time to resource faculty engagement in IPE. Just wondered if you had any comments on that.
Yeah, I mean, faculty development is critically important, but it's difficult to say, again, how the development is occurring. So is it occurring at a grassroots level where colleagues are talking to each other, or are there formal initiatives that are being put into place? And certainly if resources are limited, and finding additional resources, either in terms of faculty time or real dollars, could be problematic for some programs. So I think from what we saw, there was definitely faculty development was occurring, but we didn't dive deeper to find out exactly what that consisted of. So more information to come on that.
Okay. Did you ask about sources of internal funding for IPE programs? In other words, how that internal funding was being collected?
No, we did not.
We did not. Again, this is another situation where we found we had more questions than answers around particularly the funding of IPE. Any ideas to enhance institutional buy-in? I work for an AHEC which promotes IPE. We are actually working with PCOM Georgia, which is DOs and pharmacists, West Georgia Universities, and Abraham Baldwin College for Nursing. So any ideas to enhance institutional buy-in from the panel?
Andrea, do you have an answer to
that is
maybe, since you've been at a couple of institutions lately?
Question. You know, I guess what I would say is it is an ongoing it's the care, and I call it the care and feeding of IPE. You cannot turn your back for a second, not for a second. And you really do have to like be out and about. In terms of institutional buy-in, probably the biggest lesson that I am learning as I move through my career in this area is when you have centralized resources, it's really, really important that that doesn't remove responsibility, accountability, and decision-making from the academic units, because that is one critical place where you can lose the battle. You can win the battle but lose the war, sort of a thing.
I think one of the other things that I totally agree with Andrea, and one of the things that I found too is the buy-in works best when there's something in it for everyone. Like, so how are you going to, let's say you want to have an academic clinical partnership, how is the academic side going to benefit and how is the clinical side going to benefit, so that everyone feels that they're getting value added from the collaboration and that it's not a burden.
Mm-hmm. There's a question, someone would like to know if we're going to share the slides. I don't know if that decision's been made. San Diego, or anyone on any of the panelists have an idea about whether we're going to share the slides or not?
I wouldn't see why not, right? So, Sean, I don't know if we can, if there's a way to do that.
Yeah, we can send out the slides afterwards.
Perfect.
And did we share how the 131 organizations were selected? Patricia, I think you did talk about that at the beginning, but perhaps folks didn't catch that. Do you want to go over that again?
I believe that San Diego put the link in the chat. So if you scroll through, you'll find the link. And then you can answer a few questions. I believe it's reviewed at the National Center. And then it's really a self-selected, like you're telling the National Center about your program, and then they can review your responses and put you up on their website. I don't know if Dr. Aronson or San Diego would like to add any more to that.
No, Patricia, just to your point, and I think you've all made the point, this is a self-selected group based on those who've identified themselves. And obviously, we want to keep growing that group. So if you're not on the list, please let us know.
Dr. Aronson, I'm glad that you jumped in there. This is a question for the panelists and you as well. My concern is that IPE learners graduate into an environment where IPE activities are not financially supported. Is there a change coming in that regard? Will team patient care have increased support in the future?
Chris, please take a stab at this. I'll take the first stab, which is, certainly from day one, the National Center has been in this space of not only thinking about interprofessional just on the education side, but it has to be on the practice side. So, I do think we are starting to move the needle, right? And there are more moving away from fee-for-service models into more advanced payment opportunities that essentially are starting to look at quality, and of course teamwork is part of that. So it is starting to occur. It's occurring, I think, more in certain pockets and in certain areas of the country more than others. It's a slow process, but we're starting to see that. Chris, would you like to share more about what's happening nationally in that regard?
Yeah, thanks, Sarah. So I would echo everything that you just said. For some reason, my video is intermittently working here. Sorry. I think one of the things that we're very interested in and working hard on at the National Center is developing the database for how, when teams work better together, the outcomes are better, both for patients and outcomes that health systems are, concerned about. And I think all the models that you've alluded to are helping. I think the pandemic, the third or fourth pandemic in the healthcare world around burnout, we know that effective teamwork helps prevent burnout and retain staff. So we think that the evidence is starting to develop. And so, we all need to keep getting the word out. We share the concern for sure.
An interesting trend that I'm observing, certainly in our region in New York, is health systems are actually developing interprofessional primary care practices. And the only way you can have access to them is if you're part of that insurance. I shouldn't say health system, insurance provider. So Blue Cross and Blue Shield are now opening up in our region a number of interprofessional primary care practices that include primary care physicians, nurse practitioners, behavioral health counselors, pharmacists, right in that. And so if you're a member of that insurance, health insurance program, then you have access to these. And so I think that that's an interesting phenomenon that's happening, and that certainly is signaling something. I'm not exactly sure what, but definitely it's signaling a thumbs up for interprofessional education and collaborative practice as something that the insurers are investing in.
The thing that I'm not seeing as much of as I really expected to and would like to see more of is the integration of learners into these primary care interprofessional team models. Allowing them to be there is one thing, but really integrating the power and the promise of bringing learners into the conversation and the care model is, I think, has yet to be exploited fully. Another question, do we know that from the survey to what extent the well-developed programs are doing clinical versus preclinical IPE, or to what extent these programs include curricula that extend from matriculation to graduation in each participating school?
We are looking at some further analysis, and I mentioned the manuscript where we are starting to see if there are any correlations between some of these factors. And that the first part of that question, I see it's from our colleague Steve. Hello, Steve. Is yes, we're looking at that. So we don't have the data to share today. In terms of the other piece about diving more into curricula, that really was not part of this survey. We really wanted it to keep it more high level in terms of the organization. I think there's certainly room, and you know, I'm not certain that AIHC or the National Center are going to be you know, developing another task force around this, but I would certainly say that I think there is room to see what is you know, the current state of IPE curriculum, and you know, what is going on in this space. I think that we don't know, you know, so I think that that is another great research question.
Did you look at, or are you planning to look at, the interprofessional collaborative nature of the IP teams or centers themselves, and how that is tied to the success or failure of the programs? We sure talked about this a lot.
We did. Yeah, I mean, again, I think there's some of the analysis that we're doing. I think that, you know, and I think it would be interesting if people wanted to comment in the chat box. You know, if in the next iteration of the survey, you know, I think one of the things that, again, we don't know is because we didn't know really what was happening across the United States. And so this is our first attempt at doing that. But I think the next iteration becomes of the people that answered these questions, do they feel that, you know, they're doing this well, or they're resourced well enough, and what are their outcomes? So I feel like there's probably room to ask that type of a question in some way on the next iteration of the survey, to begin then to make some of these correlations, you know, that you guys are asking in the chat questions. I just don't think we have that data at this point to be able to do that with what the current version of the survey was attempting to do.
A suggestion in the next survey, can we see if institutions are setting aside dedicated academic time for IPE, i.e. a day a month or an afternoon a week? Biggest problem we have is coordinating academic schedules. Amen. Amen. I think that is, if we can just start, and if we had to pick one place to start, for sure, setting aside a dedicated time, protected time for interprofessional learning makes a big difference in terms of the care, in terms of the amount and depth of interprofessional education that can happen. what professional schools tend to be driving IPE programs, e.g. pharmacy, OT, PT, medicine, nursing, etc.? We did not ask that question. We did not. I don't even think I think we could look at the data all day and we would not be able to pull that particular information out. I think it's a good question to ask, and I would love to see how that relates to accreditation requirements, as well as a number of other factors. But we did not look at that in the survey.
And I guess I would like to just mention that, I mean, there are so many wonderful questions that we did not address. Some of them you're bringing up that we talked a lot about. What should we include? Some of you are typing in the chat box things that we didn't necessarily even discuss. So we'd love to hear feedback, but at the end of the day, what we came up with, we used past survey items, as Patricia was talking about. There were a few reports out there already prior to this one, and we included the people that authored those reports specifically on the task force.
Yep.
But then at the end of the day, what we were really trying to think about was what were the most important areas in a way that we could develop a survey that would not be overly burdensome for people to take, because there are so many questions that we all have. And so we wanted to try to keep it in terms of a reasonable amount of questions and a reasonable time for people to be able to actually return the results back to us. But certainly we're looking for other recommendations. Just wanted to.
A lot of interest in the questions around the collaborative nature of IPE. Everything from, were those those organizations that were more collaborative, do they have better programs? To, are we seeing the number of collaborations across institutions? Is that a common trend across the country, or is that related to IPE because folks are, I'm going to use the word desperate to connect with people, and any and all resources and support is helpful. And then a few comments around integrating team care, which are very helpful. I hope that we can capture the chat. I'm going to pull us to a close as we are getting close to time, but I'm really very grateful for the opportunity to have been part of this work. I'm grateful to the support from the National Center in moving it forward with us, and the American Interprofessional Health Collaborative members and team members that are on the task force, as well as those that have provided responses to our questions about the survey and the process that we use to gather data and analyze it. And Sarah, I would be remiss if I did not acknowledge your leadership throughout the process. You've just done a beautiful job. So without further ado, we will give you the rest of your afternoon back. You get a whole 3 minutes. And thank you so much for your attendance. We are very anxious to hear from you if you have comments or thoughts after the webinar is over as well. You can go to the next slide, Sarah. And contact Sarah if you have any additional, as I said, feedback, thoughts, or have any questions that we can answer for you. Thanks very much.